Let's focus on KwaZulu-Natal now. Premier Sihle Zikalala has delivered a total budget of 802 million rands for the province. 66 million rands of that budget is for the Amazulu Royal Household, which is 5 million rands less than last year. Mr. Zikalala joins me now to discuss this and other urgent matters in the province. Thank you very much for joining me this evening, Mr. Zikalala. The royal succession has been in the news, so let's start there. Why the reduction in the royal budget?
Well, thanks for the opportunity to clarify issues. The reduction in the budget is across all programs within the Premier's office. This is because of the cut that we have experienced, because our budget has been reduced from the national government, and all departments have been affected. And similar, the Premier's office got affected as well, and all sub-programs within the Premier's office have been reduced in terms of allocation. So that cuts across departments, it cuts across all sub-programs.
Okay, so let me ask, who decides how the money is spent now? That's 66 million rand. Who decides how it's spent?
Well, that money does not go to the king per se, but it is for programs that are annual programs that are in the schedule of government. But also, it's also the money for maintenance and repairs of the royal palaces. And who decide it's the assessment on the work that needs to be done per palace. But also, then the bigger chunk goes to cultural events and cultural ceremonies that are hosted in the royal house.
So do you sign the check then? So someone comes to you and says, okay, this is what money needs to be spent on, and then that check needs to be signed by you? Is that how it works?
No, it doesn't work like that. It follows all procurement processes of government. When there is an event or when there is something that needs to be done, we follow the procurement process of government through the respective officials who are assigned to those responsibilities.
And where does the budget come from? Is it ratepayers of KwaZulu-Natal? Is it national taxes? Where exactly does the money come from?
Well, we've got various, we generate revenue as government, as the province, but also national allocates to provincial government and municipalities. And from there, the provincial government allocate per departments. And from that allocation, we then allocate for various programs within the office of the Premier, including the program within the royal household.
Does the amount exclude the cost for the coronation and any possible future royal wedding?
If there are such activities, those activities will be catered for within this budget. It inclusive of everything that as the government we do for the royal house.
Okay. Thank you very much for that. Let's move on to the COVID issue right now. Obviously, you're aware that in Gauteng there's a report that we are now entering the third wave. How are you preparing for what is inevitably going to happen in KZN as well?
Well, we are ready. Firstly, we have started resuscitating educational programs that seek to create an awareness on prevention. And we are still pushing or appealing that let us all embrace the non-pharmaceutical preventative measures.
And how much money are you spending? What's the budget allocation to save lives and prevent a health crisis in KwaZulu-Natal?
Well, I wouldn't say this is a specific figure because, for instance, in the awareness campaign, the Premier's office contributes, the Department of Health contributes, and other departments that are part of this process. So I wouldn't right now say this is the amount. But also, we have also advanced with the vaccination programs. I can speak with certainty that most of the healthcare workers have been vaccinated.
Okay, it's taken an age to vaccinate healthcare workers. We now need to get to very vulnerable members of the population, people over the age of 80. There are many of them in KZN who've probably registered. Many of them haven't received an SMS yet. What role do you play? I mean, it looks like the Department of Health manages all of this, and you have to step aside and just wait for them. How are you helping to expedite this to save the lives of the people in your province?
No, we don't step aside and look on the Department of Health. We are part of the process. The last Provincial Command Council held on Wednesday had a dedicated discussion on the plan. And our plan for phase 2 include vaccination in mass centers where we cater for the elderly and the frontline workers of various departments. We are doing so per district. And in each district, we've got vaccination centers that have been established. We also have the registration system where people register, and then we then allocate or dispense the vaccines, and then we are ready by Monday. All those who are part of the first team of the phase 2 will be definitely vaccinated.
All right, let me ask this. Obviously, we've had this horrendous experience that happened in India, mainly accelerated by cultural and religious super spreader events. If we are to have a coronation, we know how important that is. There'll be a massive crowd that will want to see the coronation of the new king. How do we prevent a similar situation happening in our province? Because we're going to have this in the midst of what is COVID, the next COVID wave.
Well, that will be dependent on when the processes of coronation are finalized in the engagement with the Royal House. But you have seen with the burial or the ceremony to bury His Majesty the King, and subsequently the regent, we have been able to preserve or to follow protocols and try to cap the spread of COVID.
Okay. All right, with the local government elections coming, so thank you for the explanation about how you'll manage the coronation. Final question. You've got the local government elections coming up in October. Now, that means campaigning is going to start very soon. Now, if we go back again to what happened in India, campaign rallies were massive super spreader events. How are we going to manage that here? Because sometimes politics overtakes the health of the people, and campaigns are potentially very risky events to have leading up to the local government elections in the middle of this pandemic.
I think through the government, through the IEC, we need to reach to all parties to ensure that the manner in which they campaign does not expose the people to COVID-19. When people do rallies or door-to-door, they must not expose others to the risk of COVID-19. We are hoping that all political parties will follow that. We are not going to say let's postpone elections, but parties must adapt to new ways of campaigning. And that's what we would want to emphasize as the government.
Thank you very much. KZN Premier Sihle Zikalala speaking to us about a number of issues important in KZN. Still